Oncology, the leading provider of cancer care services in the whole of the Republic of South Africa, and they place their patients in the center of everything they do. This ensures, of course, that patients receive the right treatment at the right time and at the right price, which is something that is so important, especially for something that you genuinely cannot control, which is cancer. Listen to this.
Young Blood 5.
On Young Blood 5 this week.
On the line with us, we are joined by Dr Sudeshen Naidoo, spokesperson out at Icon Oncology. Breast cancer is, of course, a huge talking point in our country, as it should be everywhere, but particularly this month, right? To, let us in on some of the focus that you have on breast cancer prevention and also early diagnosis and why it's so important.
In terms of prevention and early diagnosis, so we would always want to find a cancer disease that is a very early stage, because breast cancer treatment can be highly effective in achieving survival possibilities of about 90% or higher, particularly when the disease is identified at an early stage. So it's good prognosis, good prognostic factors. People live for a longer period of time and have a good local control of the disease, and systemically if the disease is found at an earlier point in time. So we advocate that people actually do breast self-exam once monthly and actually look out for any signs or symptoms that could raise a red flag for them to go to their local medical doctor. And some of those red flags would be a breast lump out of the ordinary, or thickening of the skin, any alteration in size of the breast, shape or appearance of the breast, if they have dimpling on the skin, unusual redness or pitting of the skin. We know that not every lump is an actual cancer. So as many as 90% of breast masses are not cancer. So the first thing someone should always do is actually go to their doctor, and preferably go to a breast mammography specialist clinic.
What kind of treatment types are available for women who, may have breast cancer?
When one is diagnosed with breast cancer, there's 3 different treatment modalities one can go through. One has to have surgery, and that surgery can be split into something called a wide local excision, where you just take the lump out from the breast or where the disease was. Then one can also do a mastectomy, and that's patient choice. But that also depends on the stage of the disease and what is the advancement of the disease. The second thing is that if you have a invasive cancer that's somewhat aggressive, then the patient may be a candidate for chemotherapy, and patients generally have about 5 to 6 months of chemotherapy. The third modality, which is 50% of cancer patients generally go through therapeutic radiation or radiation therapy. Now, in breast cancer patients, if one has to have a lumpectomy done, generally they have radiation therapy done. If a patient has locally advanced disease, so if a lymph node has become positive, then they have to have radiation therapy done, and that's given by a radiation oncologist or clinical oncologist.
Do you have any current or upcoming campaigns at Icon Oncology?
So we know currently that there is a cancer crisis that is hitting South Africa from a human rights point of view. So about to be launched is something called the Johnson Rose Cancer Foundation, and this foundation will try and hope to give access of care to people that are partially insured or uninsured, fund their treatment, plus also try to fund new doctors that want to become oncologists. Currently now the statistic is 15% of oncologists in the state sector are treating 85% of the uninsured oncologists. And that leads to a crisis, long waiting list with patients that cannot receive chemotherapy or radiation therapy. So we are hoping this new foundation that gets launched would actually fund those patients and actually create new oncologists in South Africa.
Now, if anyone has any questions or wants to seek more information, where can we find you and how do we get in touch?
So you can get in touch with me on the website cancersa.co.za. My personal practice is at the Santon Oncology Center, located in Morningside.
Thank you so much, Dr. Naidoo, for your time and all the incredible work that both you and your team do for the community. We salute you here on 5FM.
Young Blood 5. Saluting champions who are making a difference. Check out the